Hello, I am Dr. Stephen Mott. I'm a developmental cognitive neurologist, medical director of the Child Development Program here at Dartmouth-Hitchcock Medical Center. By using this Look and Share demonstration, you'll be able to see how one can present an object and analyze the child's nonverbal communication. Studies by Ozanoff and Landa using videotapes and reviewing early videotape development of children with autism have shown that at between 6 and 8 months, one can see a failure in the development of making good eye contact and communicating needs of wanting objects outside of their reach. So we feel that one should be looking for that, particularly in children that are siblings of children that have been identified previously with autism. So very simply, what we're asking you to do for less than 30 seconds of your office visit is to have a child sitting in their mother's lap facing you. You take an object. We're going to be using a red ball of yarn and placing it within the child's reach at their stomach level. When they reach for it, you then retract it out of their reach, and what we expect is that they will then look up at you as the owner and of the object in a means to connect socially with direct eye-to-eye contact. The third step is that they look back at the object that they desire. We expect that to occur sometime between 6 and 8 months, so you can begin to look for it at 6 months. All right. So she's sitting in Mom's lap facing me, and I get her attention, and then I present the object at her stomach level. Look for her to reach. I don't let her. Pull it back. She looks at me, then she looks back at the object, and I let her touch it. Good. So the second procedure that we would like you to do is when you've gotten the child's direct eye contact, to move your head laterally to the left and observe the child's eye pursuit. Do they continue to make direct eye contact in a very smooth fashion as you are moving? Repeat the same procedure by moving your head to the right and make the same observations of eye-to-eye contact. Baxter. Thank you. Additionally, we'd like you to ask 2 questions of the family. One, when they're in their high chair or booster seat, and there's some objects that they would like that's out of their reach, how does your child communicate to you that they want that object?
She looks at it, looks at me, looks back, looks at me, looks
Great.
back.
Good.
Reaches, yeah, and
Okay.
then we'll give a little shout of some kind.
Very good.
Some kind of verbal expression.
The second question is when you walk into the room where the baby is in the crib, how do they recognize your presence if they're awake?
He puts his arms out saying, hold me, take me out of the crib, because he's standing up in the crib.
And he's looking at you.
Yeah, of course, yeah.
So he looks at you and
Yeah.
he lifts up
And
his
he
hands.
just,
and stuff like that.
does this and come and grab me.
Okay.
Other days he'll just, when he gets up, he'll just quietly play in the crib. So when you enter, he gives you a big smile. He sort of
Great.
recognizes.
And he wants you to pick him up and
Oh,
hug
yeah.
him and take him out of the crib.
Yeah, yeah.
So what you've observed was a very compliant 6-month-old, 9-month-old, and a somewhat difficult 12-month-old. Even in a child that's fussy, this look and share can still be observed.